Hi, and welcome viewers of Nursing Academy 101. Today, we are going to take a quick overview of the top tips on the maternity intrapartum care related disorders to ace the NCLEX and Prometric exams for nurses. But before we start, please don't forget to subscribe, like, and share the channel to encourage us to continue and provide you with all in you. The first disorder is abruptio placenta. Abruptio placenta refers to the premature separation of the placenta from the uterine wall after 20 to 24 weeks of gestation. It can occur as late as the first or second stage of labor. The degree of placental separation is classified from grade 0 to 3, which determine the fetal and maternal outcomes. Perinatal mortality is influenced by the degree of placental separation and fetal maturity level. Complications such as hypoxia, prematurity, and anemia can arise. The maternal mortality rate is approximately 6% and depends on factors such as the severity of bleeding, presence of coagulation defects, hypofibrinogenemia, and the time between placental separation and delivery. The key signs and symptoms are acute abdominal pain and a rigid abdomen, dark red vaginal bleeding with hemorrhage. The key test results are ultrasonography can locate the placenta and detect clots or hematomas. The key treatments: transfusion of packed RBCs, platelet and fresh frozen plasma if necessary, cesarean birth. The key interventions: avoid pelvic or vaginal examinations and enemas, administer blood products and closely monitor vital signs, position the client in a left lateral recumbent position. Second disorder, amniotic fluid embolism. Amniotic fluid embolism occurs when amniotic fluid enters the maternal circulation due to a defect in the membranes after rupture or partial abruptio placenta. During labor or the postpartum period, solid particles such as skin cells enter the maternal circulation, forming small emboli that reach the lungs and cause a massive pulmonary embolism. The signs and symptoms are cyanosis and chest pain, tachypnea and sudden dyspnea. Test results: intrapartum electronic fetal monitoring may reveal fetal distress. Arterial blood gas results may show hypoxia. The key treatments are oxygen therapy, including endotracheal intubation and mechanical ventilation if respiratory arrest occurs, cardiopulmonary resuscitation if the client is apneic and pulseless, emergency delivery by cesarean birth. The key interventions include assess respiratory and cardiovascular status, assess fetal heart rate, perform CPR if necessary, assist with immediate delivery of the neonate. The third disorder is disseminated intravascular coagulation. Disseminated intravascular coagulation, or DIC, refers to the excessive production of prothrombin, platelets, and other coagulation factors, leading to widespread formation of blood clots, depletions of clotting factors, and subsequent hemorrhage. The signs and symptoms include abnormal bleeding, petechiae, hematoma, ecchymosis, cutaneous oozing, oliguria, and the test results include coagulation studies may show a decreased fibrinogen level, a positive D-dimer test specific for DIC, prolonged prothrombin time (PT), and prolonged partial thromboplastin time (PTT). Hematology studies may reveal a decreased platelet count. The key treatments include transfusion therapy, including packed RBCs, fresh frozen plasma, platelets, and cryoprecipitate, treatments of the underlying cause, immediate delivery of the fetus by cesarean birth. And the interventions include monitor cardiovascular, respiratory, neurological, gastrointestinal, and renal status, monitor vital signs frequently, monitor intake and output, administer blood products, and closely monitor the client for signs and symptoms of a transfusion reaction, monitor the results of serial blood studies. The fourth disorder is dystocia. Dystocia refers to long, difficult, or abnormal labor. Approximately 10% of women experience dystocia during the first stage of labor, when the fetus assumes the vertex position. The signs and symptoms include arrested descent, hypotonic contractions. Test results: ultrasonography can reveal fetal position, malformation, or a fetal weight greater than 4,500 grams. Treatments include delivery of the fetus by cesarean birth if labor fails to progress and the mother or fetus shows signs of compromise, uterotonic agent such as oxytocin, pitocin if contractions are ineffective, and the interventions include monitor maternal vital signs and fetal heart rate, assist the patient in a left side lying position, monitor the effectiveness of oxytocin therapy, and watch for complications. The fifth disorder, emergency birth. In situations where the well-being of the mother or fetus is at risk, an urgent delivery of the fetus may be required. Causes for such emergencies include a prolapsed umbilical cord, uterine rupture, or amniotic fluid embolism. The signs and symptoms include: for prolapsed umbilical cord, usually visible cord at the vaginal opening, fetal monitor strip showing variable decelerations or bradycardia. For uterine rupture, abdominal pain and tenderness, particularly during contractions, or a sensation of something tearing. Excessive external bleeding, fetal heart rate abnormalities such as a late deceleration, reduced variability, tachycardia, bradycardia, or the absence of fetal heart rate, palpation of the fetus outside the uterus. For amniotic fluid embolism, usually chest pain, coughing with pink fuzzy sputum, increasing restlessness and anxiety, sudden dyspnea, rapid breathing, tachypnea. The key test results: for prolapsed umbilical cord, ultrasonography confirmed the presence of a prolapsed cord. For uterine rupture, ultrasonography may reveal the absence of the amniotic cavity within the uterus. For amniotic fluid embolism, arterial blood gas analysis shows hypoxemia. The treatments include administration of oxygen through nasal cannula or mask, endotracheal intubation, and mechanical ventilation may be necessary in the case of amniotic fluid embolism, emergency cesarean delivery. And the key interventions include monitor maternal vital signs, pulse oximetry, and fluid balance as well as fetal heart rate, provide maternal oxygen supplementation through cannula or mask at a flow rate of 8 to 10 liters per minute, ensure proper intravenous fluid replacement, position the client in a left lateral recumbent position, obtain a blood sample for hematocrit, hemoglobin levels, prothrombin, partial prothrombin, fibrinogen level, platelet count, and blood typing and cross-matching. Monitor the administration of blood products as necessary. Prepare the client and her family for the possibility of a cesarean delivery. The sixth disorder is fetal distress. Fetal distress refers to a compromised state of the fetus that can lead to a potentially life-threatening condition. The signs and symptoms include fetal monitor showing bradycardia or a fetal heart rate greater than 180 beats per minute, decreased fetal movement. Test result: fetal scalp blood sampling reveals acidosis. The treatments include supplement oxygen through a face mask, typically at a flow rate of 6 to 8 liters per minute, intravenous fluid administration, emergency delivery of the fetus through vacuum aspiration, forceps, or cesarean birth. Interventions include monitor fetal heart rate, fetal activity, and fetal heart rate variability. Assist the client in a left side lying position. The seventh disorder, inverted uterus. An inverted uterus can occur during the delivery of the placenta, either partially or completely. The signs and symptoms include sudden gush of blood from the vagina, severe uterine pain. Test results include hematology tests show decreased hemoglobin and hematocrit levels. The treatments: fluid resuscitation using intravenous fluid and blood products, administration of supplement oxygen, immediate manual replacement of the uterus, possible emergency hysterectomy, tocolytic agents, terbutaline. And the interventions include administer supplemental oxygen, monitor vital signs frequently, monitor intake and output. The eighth disorder, lacerations. Laceration refers to tears in the perineum, vagina, or cervix that occur due to tissue stretching during delivery. Lacerations are classified into first, second, third, or fourth degree. Signs and symptoms: increased vaginal bleeding after the delivery of the placenta. The test results include hematology studies may reveal decreased hemoglobin and hematocrit levels. Treatment: laceration repair, analgesics, ibuprofen, Motrin, acetaminophen, and oxycodone, acetaminophen, Tylenol. Interventions include monitor vital signs including temperature, monitor the laceration site for signs of infection and bleeding, insert an indwelling urinary catheter if indicated. The ninth disorders, precipitate labor. Precipitate labor occurs when strong uterine contractions lead to a rapid delivery within a short time frame, typically less than 3 hours. It can be associated with multiparty or the induction of labor using oxytocin or amniotomy. The signs and symptoms: cervical dilation of greater than 5 cm per hour in nulliparous women or more than 10 cm per hour in multiparous women. Test results: there are no specific diagnostic test findings for this complication. The treatment: controlled delivery to prevent maternal and fetal injury, and the intervention: monitor fetal heart rate and its variability. The tenth disorder, premature rupture of membranes, PROM. Premature rupture of membranes refers to the rupture of membranes after 37 weeks of gestation but before the onset of labor. Prolonged PROM increases the risk of chorioamnionitis if the time between membrane rupture and labor onset exceeds 24 hours. Preterm PROM occurs before 37 weeks of gestation. The main signs and symptoms include gushing or leaking of blood-tinged amniotic fluid from the vagina, uterine tenderness. The test results: vaginal probe ultrasonography can detect a tear or rupture in the amniotic sac. The treatments include hospitalization to monitor for maternal fever, leukocytosis, and fetal tachycardia if pregnancy is between 28 and 34 weeks. If infection is confirmed, labor may need to be induced. Oxytocin agents, oxytocin, pitocin, for labor induction if the pregnancy is at term and labor doesn't begin within 24 hours of a membrane rupture. The interventions include assess for signs of infection or fetal distress, administer antibiotics as prescribed, encourage the client to express her feelings and consent. The 11th disorder is preterm labor. Preterm labor refers to the onset of labor before the completion of the 37th week of gestation, posing a high risk for both the mother and the fetus. The main signs and symptoms include pelvic pressure or abdominal tightening, increased vaginal discharge, intestinal cramping, uterine contractions leading to cervical dilation and effacement. Test results include electronic fetal monitoring confirms uterine contractions, vaginal examination confirms cervical effacement and dilation. Treatments include administration of betamethasone intramuscularly at regular interval over 48 hours to enhance fetal lung maturity in case of expected preterm delivery. Tocolytic agents such as terbutaline and ritodrine, Utopar to inhibit uterine contractions, magnesium sulfate to maintain uterine relaxation. And the interventions are monitor maternal vital signs, contractions and fetal heart rate every 15 minutes during tocolytic therapy. Continuous fetal monitoring should be provided otherwise. monitor for maternal adverse reaction to terbutaline or rituximab, monitor for magnesium sulfate toxicity and ensure that calcium gluconate is available, assess the neonate for possible adverse effects of endometriosis inducing such as premature closure of the ductus arteriosus. The 12th disorder is prolapsed umbilical cord. A prolapsed umbilical cord occurs when the umbilical cord descends into the vagina before the presenting fetal part. The signs and symptoms include visible cord at the vaginal opening, variable decelerations or bradycardia observed on the fetal monitor strip. Test results: ultrasonography may reveal the cord at the presenting part. Treatments: immediate delivery of the fetus, and the intervention: place the client in tridental position, hips higher than the head, in a knee to chest position. Monitor fetal heart rate and its variability. The 13th disorder is uterine rupture. Uterine rupture occurs when the uterus experiences excessive strain. Without emergency intervention, it can lead to maternal and fetal death. The signs and symptoms include abdominal pain and tenderness, especially during peak contractions or with a sensation of something gripping, late decelerations, reduced fetal heart rate variability, tachycardia and bradycardia, and cessations of fetal heart rate. Test result: hematology test reveals decreased hemoglobin and hematocrit level. Treatments: fluid resuscitation with intravenous fluid and blood products via rapid infusion, surgery to remove the fetus and repair the tear, or hysterectomy if necessary, oxytocin, pitocin to help contract the uterus, and the interventions include monitor vital signs frequently, prepare the client for immediate surgery.